Breaking news. Doctors in the Federal Capital Territory, Abuja, have begun an indefinite strike, shutting down medical services in public hospitals. This action is already sending shockwaves across the capital, leaving ordinary Nigerians in fear and uncertainty about where to turn in times of medical need. But let us be clear, this is not just a strike. This is a symptom of a far bigger problem: the decay of Nigeria's healthcare system, the failure of leadership, and the silence of a people who have grown too weak to demand better. For decades, our hospitals have been neglected. Facilities lack basic equipment. Power outages disrupt surgeries. Patients are asked to buy their own syringes, gloves, and even medicines that should have been available in the hospitals. Our doctors, men and women who sacrifice daily to save lives, are underpaid, under-equipped, and overworked. This is why many of them leave the country. Every year, hundreds of Nigerian doctors migrate abroad, especially to the United Kingdom, Canada, and the United States, where they are valued and respected. Back home, their colleagues who stay are left to struggle in broken hospitals. And when they demand better treatment through strikes, the government's response is usually silence or empty promises. The painful irony is that our leaders do not even use these hospitals. When they fall sick, they jump on the next flight to London, Dubai, or Germany. Former President Muhammadu Buhari spent months abroad receiving treatment. And he is not alone. Ministers, governors, and top politicians all do the same. If the very people who control billions of naira in budget allocations cannot trust Nigerian hospitals, how do they expect ordinary Nigerians to? Leaders treat foreign hospitals as their backup plan, while the poor masses are left to die in understaffed wards. Right now in Abuja, the poor are the ones suffering. A child with malaria may not find a doctor. A woman in labor may not get a midwife. A man with a heart condition may be turned away. And while this happens, the rich will simply drive past the public hospitals and enter private clinics or even book flights abroad. This is not just unfair, it is wickedness. But let us ask ourselves, how did we get here? The truth is, bitter Nigerians have grown weak. We have adjusted to pain. We see injustice and shrug. We bury our loved ones in silence. We complain on social media, but rarely take action in real life. Other countries protest when hospitals fail. Citizens rise up when their leaders abandon them. But here in Nigeria, we normalize suffering. We accept bad governance like it is destiny. And our leaders know this. That's why they keep failing us. To Professor Muhammad Ali Pate, the coordinating Minister of Health and Social Welfare, Nigerians are speaking directly. Use your office to resolve this strike. You may not understand what the masses are going through because you and your colleagues don't use Nigerian hospitals, but the people are dying. You cannot continue to watch doctors abandon public hospitals while ordinary families suffer losses that could have been avoided. Healthcare is not a luxury, it is a basic human right. This strike should serve as a wake-up call. Nigerians must stop being silent. We must stop excusing bad leadership. The time has come to demand accountability, to insist that leaders fix the system they swore to govern. We must remember, a nation without functional hospitals is a nation at risk. Today, it is the poor who suffer. But tomorrow, it could be anyone. Sickness does not respect class, tribe, or religion. If we do not act, the cycle will continue. More strikes, more deaths, more frustration, and more leaders escaping abroad while the rest of us suffer. HopeStreamNews will continue to follow this story because this is not just news, it is about life, dignity, and justice for the Nigerian people.